This conference will now be recorded.
Good morning, students. Just give me a few seconds. I'll just upload the scanned copy of it. I forgot to do that. Just be on the line for a few minutes.
This conference will now be recorded.
Okay, can you see the slides? Can you all people see the slide?
Yes, sir.
Okay. So we are going to understand today the role of pharmacoepidemiology in assessing drug-induced birth defect. Role of pharmacoepidemiology in drug-induced birth defect. Now, we need to know certain basic things. One second. Okay. Now, we need to understand certain basic things about the relationship between the drug and birth defect. Now, when you think that the drug can produce the effect on the growing fetus, can you reply? Just ask Manoj.
Yes, sir.
When the drug produces the effect on growing fetus, or whether the drug produces the effect on growing fetus?
Yes, sir. It definitely has the effect on the fetus.
Okay,
And
but yeah,
when it
what
can pass
stage?
through the placenta,
Uh-huh.
this produces the effects on the fetus.
When it can produce the effect?
Sorry, sir.
When it can produce the effect on the fetus?
So once the drug starts metabolizing,
When the drug start metabolism. Okay, let us
yeah,
move
sir.
on to Atira. Atira,
Yes,
when
sir.
the drug produces the effect on the growing fetus?
So, when the drug which are able to pass the placenta barrier, it will show the effect on the fetus.
Okay.
Like like if the fetus is affected or not, we'll get to know after 9 months, like when the infant is born, baby is born.
Now, who has to consume this drug to produce the effect on fetus?
The mother, when the drug is taken, when the mother has any diseases or anything.
Is it a mother or a pregnant woman?
Pregnant woman, sir.
Mother is known. Mother. We usually use the mother after she gives the birth to child, and then postnatal care. That is where her mother name starts up there. And initially, I'm speaking initially.
Okay.
So when pregnant woman takes the drug, it produces the drug produces the effect. Correct?
Yes, sir.
Okay, I appreciate your knowledge that drug passes through placenta and then reaches the fetus to produce the effect. But it can produce the effect only if pregnant woman takes it, right? Otherwise, if non-pregnant woman takes the drug, does it produce the effect? Ria Sara.
Yes, so oral contraceptives are said to produce such effects.
Hmm.
Um, then yes, only certain drugs, not all the drugs do.
Uh,
Before
is there any gap between the consumption of the oral contraceptives and the time required to go for pregnancy? Is there any safe time?
I don't know about it, so I've just
Ah,
heard about.
okay, you have heard. So you have heard that such contraceptives can cause the problem to the growing fetus.
Yes, sir.
Okay. There is a safe period where the drugs needs to be stopped for at least 6 months before planning for pregnancy. Do you know that?
No, sir.
Huh. So there is a period, safe period, where the drugs have to be discontinued for at least 6 months. At least maximum is better. At least 6 months, so that all the drug that was taken earlier will get eliminated from the body. Then the chance of the effect from such drugs on growing fetus will be less or no. Will be very less or no. Usually it is no. Okay, so usually in such case, if non-pregnant woman takes the drug, it does not produce any effect on the growing fetus because the woman is not pregnant, right? I hope this is clear. So we know that the drugs produce the effect in growing fetus. Okay. When do we call the growing, uh, fertilized ovum as fetus, and when do we call it as embryo? Sufficient. When do we call it as embryo?
Yes, sir.
When do we call it?
Um, so embryo is at the first 2 weeks or 3 weeks of the pregnancy, no, before the like the start of the pregnancy.
Hmm.
So it's
Sai Srileka.
Sir, initially until 8th week, I think so. After that, it is called fetus.
Initially for how many?
8 weeks. Yes, sir.
8 weeks?
Yes, sir.
8 weeks?
It
Yeah,
is called embryo.
yeah,
Embryo.
yeah.
After
Correct.
that, it is fetus.
Up to fetus is called up to
8 weeks,
from eighth
sir.
week to
Sorry, not fetus. After 8 week, it is fetus. Up
till
to,
what point it is called as fetus?
don't know, sir.
Okay.
Um,
So
till,
yeah,
don't know.
okay. So it is called as fetus till the childbirth, right? Embryo is the one whose period start from the day the ovum is fertilized till 8 weeks is called as embryo. From 8th week till the childbirth, it is called as fetus. So you need to know this basic difference as a clinical pharmacist, especially if you're working in gynecology department, right? Okay. Now, whether the drug produces the effect which is beneficial in fetus, tenzin, or adverse effect. Tenzin, Nikita,
Yes, sir.
whether the drug
So
produces the
some drugs will cause adverse effect.
okay, remaining drugs cause.
I don't know, sir.
No, my question is very straightforward. Whether drugs produces beneficial effects in fetus or harmful effects in fetus.
Sir, harmful effects.
Yes, harmful effects. That is very right. Because you do not know what is the problem in fetus, but when it produces, it usually produces adverse effect. Very true. Now we know that the drug is taken by the mother. When the drug is taken by the mother, it produces the effect on the growing fetus, correct? Now, who in this process, who gets the benefit, who gets the unwanted effect? Marlene, Sarah?
So the pregnant woman gets the beneficial effect and the fetus get unwanted effects.
Yes, very true. So when a pregnant woman takes the drug, pregnant woman gets the benefit, therapeutic benefit, while fetus or embryo gets the harmful effect. This should be very, very clear. Now, the effect which is produced in the pregnant woman is called as the harmful effect produced in the growing fetus is called as teratogenic effect. Teratogenic effect. Terato means it is like a monster gen to produce the effect. Okay, so harmful effect in fetus is called as teratogenic effect. Whether the harmful effect is mild, moderate, or severe in growing fetus. Sonam,
Yes, sir. Yes, sir.
what you think?
Yes, sir.
What you think?
Sir, I can't hear your voice clearly.
Whether the adverse effect is mild, moderate, or severe in growing fetus.
Severe.
Can you? Yeah. Can you hear
Severe.
me? Severe.
Yes, sir.
Okay. Mega.
Severe.
Priya Pillai,
Severe.
severe. Lakshmi,
Severe, sir.
Irene, Irene
Sir,
Sada,
severe effects may happen.
Aparna,
Sir, severe, sir.
okay, Sharin Babu,
Severe, sir.
Navindran, Gearly George,
Severe, sir.
Gear, severe. Aquina,
Severe, sir.
Kessia,
Depending on the drug.
depending on the drug. Okay. So what may happen depending on the drug?
Severity will change.
Okay, such as
I don't know, sir.
your answer is correct, but I wanted the different answer. That's all. Severity changes. So you mean to say that a severe effect is not produced?
No, sir. Sometimes it's produced.
Sometimes remaining times?
Not that severe, I think.
Not that severe. So it can be moderate or mild.
Yes, sir. I think so.
You think so? Okay. Yeah, your thinking is correct. So when the harmful effect is produced in growing fetus, the harmful effect, what we call it as adverse effects, severity can range from mild to very severe in their nature. The adverse effects can vary from mild to very severe in their nature. It can be mild, it can be moderate, it can be severe, or it can be very severe also, right? Okay, let us move on next to next component. So we have understood till now that drugs produces harmful effect in growing fetus and beneficial effects in mother or the pregnant woman basically. Now let us see where this pharmacoepidemiology comes into picture here. So when mild and very severe adverse effects are produced, the pharmacoepidemiology helps to document the adverse effects which can be seen rarely among the large population included. Let us move one step further to know what type of drugs basically produces the effect and what can be done in such cases, okay, and how they are related to different drugs. So if you see here, drugs, there are two classes of drugs that are known to produce the effect in growing fetus or teratogenic effect. Very definite one. Definite drugs that are identified include thalidomide, which we are all aware, valproic acid, and isotretinoin. These drugs are known to produce teratogenic effect significantly, whereas remaining drugs are considered to be teratogenic, but they need more clinical data to say with a confirmation that they produce the teratogenic effect. So either way, either way, either type of the drugs. But if the drugs are taken by pregnant women, that is going to affect the growing fetus. Now, usually the drug can affect the fetus at two different stages, or the fertilized ovum till the childbirth at two stages. One, it can affect at embryo stage, and another, it can affect fetal stage, right? Fetal stage. Because we have already understood that before 8 weeks from the day of conception is called as embryo. From 8th week till the childbirth is called as fetus. So drugs can produce the effect in either of these two stages. Some drugs may act in between also. That we will understand later, how at what stage the each drug can act. Embryo stage is known to be cell development stage. Cell development stage, where the susceptibility for the drug action or the ability of the drug to modify the cell growth is very much higher when compared to the 8th week onward, that is called as fetus. So some drugs are very potent initially, but less potent subsequently. But some drugs are less potent initially, but subsequently they are very potent. Either when the drugs produces the effect either at the embryo stage or at the fetus stage, the birth defect is going to be seen or produced in fetus. Birth defect is going to be seen in fetus. That is what the shape it takes after childbirth. Okay. Now, birth defect in fetus, when it takes, it is a harmful effect, and mother gets the benefit from the treatment, which is very clear for us. Now, when birth defect happens at the fetus, it can vary from mild to severe or very severe in nature, correct? Which we have already understood. Now, mild, usually the clinical mild means you have to find out whether it is clinically significant. Clinically significant means to say that there is a outcome that can be observed. If it is yes, then there is a treatment required here or alteration required. If it is not clinically significant, then it is not of much importance. So in this stage, mild adverse effect also cannot be taken lightly. Here, mild side effect means to say that whether it is clinically significant, that we have to confirm. If yes, then even mild also makes a lot of difference. If no, then there is no problem. So that is why in this stage, mild also is very important. That is why we always tell you that whenever you are doing intervention, intervention in your treatment, you are supposed to report mild response also, a mild changes in the drug outcome to physician as a clinical pharmacist. It is up to the clinician to take it into consideration. So that is why mild is also very important, and especially it is important during the growing fetus. Okay, so that's the one thing. Now, if it is a severe one, if it is a severe one, there can be two possibilities. Either you can go for major surgery, like cleft surgery, especially if you see they'll stitch back the lips so that the person face becomes compatible to see. Or if it is totally disability, if the person has lost an organ, or totally organ is disabled, then you can go for rehabilitation facility. If you give a rehabilitation facility, then it can take care of the disability. So basically the adverse effects are related to drugs with respect to birth defect in fetus. So this is where pharmacoepidemiology comes into picture. What drugs are causing, in how many patients it is causing. This is on one side where pharmacoepidemiology play an important role by following the prescribing pattern. On the other side, pharmacoepidemiology helps you to understand what are the adverse effects that can be produced, uh, you know that can be produced because of the drug. So pharmacoepidemiology helps to assess the drugs that are likely to cause the problem to the patient, on especially pregnant woman, that is on the fetus. And the second one is that it helps to understand type of adverse effects that are going to be produced among the large population tested. So this is where pharmacoepidemiology comes into use in the assessment of drug-induced birth defect. Are you all clear? Can we move on to the next segment?
Yes, sir.
Okay. Okay. For a curiosity, just I'll tell one thing that earlier we used to know that you know birth defect is supposed to be sin done by the mother. That is why the the child is born like that. Now it is not like that. It is very uh, clearly explained that it is because of the drug only. Otherwise, there was a misconception that it was because of the what do you say, sin done by the mother. Now it is not like that. Another important information which I would like to share is that both public as well as physicians are well aware of the fact that drug produces adverse drug reactions in growing fetus. Okay, so awareness is good, awareness is existing, but the thing is that it is very important for a physician or a pharmacist to know before dispensing the drug right medicines, or before recommending the medicines that are unlikely to produce the effect on the growing fetus. Now, the next question comes that we know that certain drugs produces their effect on the growing fetus, but is it possible to predict their effect in human beings, especially pregnant women? If yes, what is the problem? and what makes them not able to predict the effect in the human being. That's what we are going to understand now. The difficulty in extrapolating the effect of the drug on fetus is because animal studies result which says that the drug is likely to produce the effect may not be always extrapolated to human beings. You cannot extrapolate the data to animal data to human beings. That is the limitation actually. So whatever the animal studies which is carried out may become uh, true in human beings or may not become true in human beings. So what happens, it is very difficult to predict. It is very difficult to predict what is going to happen in the human beings. This is the difficulty. Next difficulty is that SAR studies are not available to predict the birth defect of the drugs in human beings. What is SAR studies? Anybody knows it? Manoj, do you know what is SAR studies?
Don't know.
Atira James?
So is it structure activity relationship?
Yes, your answer is correct. What it is?
So like it's the study based on the structure of the drug and the activity it does.
Mhm. How do you know that the molecule can change the effect through SAR studies? Is it possible to know?
Um, I don't know so clearly.
Okay. Ria Sara?
No, sir. It's just about how a drug it shows its action in the body.
No, is it
The different
possible?
action.
Is it possible that by altering the structure of the compound, the effect is going to be produced?
Yes, sir.
Ah. So by substituting certain groups, which may be lipophilic or hydrophilic in nature, you can predict the effect of the drug. That is called as SAR studies. So we know that the certain drugs are likely to produce the effect in growing fetus. First of all, we know that the drugs have to pass through the placenta, correct? We all know that. To pass through the placenta, the drug needs to be lipid soluble, highly lipid soluble. So SI studies will tell that whether the molecule is lipophilic in nature or hydrophilic in nature. If the more lipophilic, there are chances that the drug passes through the placenta and crosses the and causes the effect. The extent of effect one cannot predict because that needs a clear study. But at least you can able to predict it. So such studies are not available, especially in pregnant women. So what happens is that you do not know what happens there. And in addition, clinical studies are never done in pregnant women. Clinical studies are not done in pregnant women. So you might have studied these concepts in clinical research also. Which population to include in the clinical trials, which population not to include. Safisha, can you tell me which are the population which we cannot include in clinical trials or clinical studies?
So, pregnant women are not included.
Mhm.
Then geriatrics.
Okay.
Then so even pediatrics also.
Yes, pediatrics also. So these are the three populations that are not included in clinical studies. So what happens is that ultimately, since the study is not done pregnant women, you do not know what happens when the drug is given to pregnant women. The one more problem is that the study which is done in non-pregnant women, you cannot extrapolate it to pregnant women because we know that adults are included in the study, clinical study, correct? So adults are of either gender are included, male or female. Just because it did not produce any effect in the patient, female patients who are in the childbearing age, say for example, 18 years to 20 or 25 years, I mean up to 35 years approximately, they are in the childbearing age. Just because you studied the effect in them, it doesn't mean that it does not produce any effect in the pregnant woman. So it is totally difficult to establish a link. So that is why if you see thalidomide, it was safe in non-pregnant women as a sedative. Thalidomide is a sedative drug. It was safe in non-pregnant women but caused phocomelia in pregnant women, right? So you cannot extrapolate it, in the pregnant woman. But later it has shown that just because it has produced the effect in pregnant woman like this, it was banned for the banned for use in what do you say, non-pregnant woman also. That is a progress, clinical progress which they have found. But initially they found that thalidomide was not was safe in non-pregnant, but not in the pregnant woman, right? So these are the four difficulties why you cannot establish the strong relationship between the drug effect and the effect of the drug and its effect on the growing fetus, right? I hope this concept is clear, right? Anybody has any doubt? Nowadays, they say that some studies are underway to extrapolate from the data from non-pregnant women to pregnant women, but it may take certain years to come up, right? Any doubt? Can we move on to the next segment of it? Can we move on to the next concept?
Yes, sir.
Yes, sir.
Yes, sir.
In the next class, what we are going to understand is that we are going to understand the relationship between the OTC medications and birth defect, right? Here we are going to understand, what medicines are prescribed and how they are related to the outcome of uh, birth defect in growing fetus, which can cause the defect, which can be presumed to cause birth defect, and what needs to be done, and how the epidemiology takes care of such issues when it is implemented. That we will take it up in the next class because it itself is a big concept. So if I to start and then I have to stop in between because you have a class at 11 o'clock, correct? Fine, no problem. We'll stop at this point. So Manoj, please send me the absentee list, and if you have any doubt till then, you can please ask. so that I can clear the things. This chapter looks a bit what do you say, dry and not connected. If any concept is not understood, let me know. We have some time to understand any doubt. I was just understanding from Manoj that few of you or many of you are having a problem in designing the field study as per the format given, and you're getting many doubts. So I have told him that you will get the doubt and you work out the way you think right by having a discussions among your team members and write the way you have understood and understood and had the skill. Okay, no matter if it becomes wrong also. I wanted you people to and basically understand the various things and various factors which you want to consider while designing the study and upload the same thing as per the last date given. Is it clear? No need to have any fear of marks. So I know that you will come across difficulties. I do consider that your marks, but I want you all people to have that discussion, understand from each other, and put your best effort to write your assignment. Is it clear? Okay. Since the time up, you can get delinked. Thank you very much.
Thank you, sir.
Thank you.